Hello, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working with the Apollo Hospitals, Bangalore. A nose injury in the sports field is a quite common thing, especially in contact sports like basketball, volleyball, or football, and obviously in sports like boxing. So, if you see a person with a nasal injury, you have to immediately give a first aid. That means you can make the patient lie down on a flat on the floor, right, and try to pinch the nostrils if the bleeding is happening from inside the nostril. And you can look for any further injuries and any deformities happening, that is the dorsum, that the outside part of the nose being bent or depressed, and if you see any external injuries, those also have to be dressed immediately. And by pinching the nose, if the bleeding stops within a few minutes, then it is fine. Then slowly you can take the person to the doctor and further medications or further treatment can be started. But if the bleeding doesn't stop, then it becomes an emergency, because nose is a place where the bleeding can be torrential. A person can be bleeding from through the nostrils, as well bleeding in the backside also through the throat, and without knowing if the person is swallowing it, he might end up with more trouble, because blood is a very bad irritant of the stomach and it will induce a lot of vomiting. So you see a person having a bleed from the nose and then vomiting blood also, it's a panicky situation. And if the injury is critical, in the sense the person's consciousness is slightly altered because of the hit to the head, then his breathing may not be in his control. So it's a more subconscious function. Then he might even aspirate blood into his lungs, which will compromise his viability. So in such situations, rapid transport to the hospital and immediate treatment instilled, securing the airway, and all the measures are done to arrest the bleed and maintain his vital signs like BP and oxygen content of the blood and pulse rate and everything is maintained. Then you can save the person.